Fighting the coronavirus is a global effort, one with many moving parts. So to better organize the crusade, a Bay Area man has come up with a first-of-its-kind free database that would allow medical organizations around the world to share their stats on the number of supplies that they have readily available to treat the virus. Olivier Zitoun joins me now with more information on this website called covidapi.org. Hello, Olivier.
Hi, how are you?
Great. So the idea is basically right now hospitals, counties, and medical offices are all a little bit in the dark about what kind of supplies they each have and how much they have unless they tediously call one another to get a hold of that information. So how would this database fill that void for a more efficient way to get that information?
Yeah, indeed. Everyone has to make some critical life-saving decision, every day, every hour, every minute to fight COVID-19. And so what we wanted to do is to provide an easy way to share that data. So everyone globally, actually, not only in the US, but at the global level as well, can access that really crucial data to make the right decision at the right time. So we're creating this open, what we call API, which is an application programming interface, which basically is a universal language for all the different databases to be able to talk to each other. So everyone can access really that information at any time.
When did you first realize that there was a need for this type of database?
Um, a few weeks ago, actually, I was starting to see data populating, on multiple different sites, Johns Hopkins and New York Times, and I was starting to see, specifically from the health systems and hospitals, clearly the need to share crucial information about ventilators and masks and crucial equipment that was needed. So as I saw the need, appearing. I thought that we need to jump on it as soon as possible to create a simple solution to ease that problem.
And so for this to actually work, people need to participate. Who do you hope gets involved?
Hospitals, for sure, all the key health systems around the country and state as well, but also manufacturers of devices and equipments. Obviously, government officials, city, state, federal, all are the key stakeholders that will benefit from it. So what we want to do is to create an ecosystem of data provider and data users, so everyone can benefit from the greater set of data sets.
So how will they be vetted to ensure that they're a reliable source?
So we are going to vet them. So we're not going to take anyone, obviously. Also, the data that will be provided will be also qualified and tested, so that we are going to use testing technology to ease that and facilitate that testing of the data. So there's a validating process to ensure, obviously, only authorized providers will be able to provide data. The access will be for everyone, though. So we really want to make the access to everyone for free. But from data providing standpoint, we really want to make sure that we're selecting, as I say, hospitals and governments as well as manufacturers.
So is the website up and running now? Can people already upload their statistics?
Yes, the website is up. People just need to connect and fill a form, and then we'll be guiding them on how to access the API and leverage this growing database.
And can you go over a little bit more specifically about what kind of information needs to be collected on this form that you have on your site?
So there's really three. We're looking at three data sets, right? One which is about the patients themselves. So we want to obviously aggregate as much data about the patient data, right? About not only the age, but also obviously the prior medical history and all the relevant health data. Number two is about the cases, obviously number of cases, recoveries, hospitalization, and others. Not just the cases themselves, but also the data around the cases, right? In terms of for example, the environment, the quality of the air, or even the weather, all the initial data, interesting data that can complement the view of the cases. And the third bucket is really about supplies, right? I mean, and I really believe that supplies is actually the number one need. So we want to cover all type of data sets around supplies, as I say, ventilators and masks and other critical supplies that are needed to fight COVID-19 today.
And so I know that this site right now is in its infancy, but eventually do you have any other vision for this to become more interactive or have maybe like a live feed going in which people can have a discussion about this as well?
Absolutely. This is just the beginning. Obviously, we started that only a few weeks ago. We have now over 350 developers, working on this. So what we'll see in the next few weeks is obviously numerous new releases, including a platform for collaboration, so everyone can, share ideas and suggest new data sets. As well as dashboards to be able to visualize, at the high level, what's the data and where are the key trends, right? I mean, ultimately, what we want to do is to more like a portal that will allow anyone to make a query to access specific data sets. But that will take a little bit more time to do. That will allow not only developers, but anyone to be able to make some very complex query on a variety of data sources.
What is the best case scenario for you to see come out of this website?
Obviously, this is about helping everyone on the ground at the front lines of this fight, to make the right decision and to save lives, right? So what we want to see is as many contributors and users of the data. That's all. And we're leveraging the power of, firstly, the open source and crowdsourced model to be able to anyone to be able to jump in and volunteer and help. That's why we're very humbled to see so many people already supporting this initiative.
All right, thank you so much, Olivier Zitoun, for joining us and talking about this universal database that you're working on.
Thank you so much.
You're watching Chronon, the Bay Area streaming news 24/7.